Welcome to the Birmingham Medical News Ask the Doctor podcast. The Birmingham Medical News has been publishing for over 20 years now in Alabama. We are a monthly newspaper that writes about all the healthcare happenings in Alabama. We hope you'll love the podcast today. In the meantime, I should tell you that our podcast, we do this in partnership with Kassouf & Company. Kassouf & Company is an accounting firm in Birmingham that has been in practice for almost 100 years. They provide, of course, a full range of accounting services. They also have a wealth management arm, and they have a medical advisory practice that has been really well regarded by Birmingham medical professionals. Our sponsor today is Waverly Advisors. Waverly Advisors is honored to be a paid sponsor of the ENT Associates Birmingham Medical News podcast. The podcast is not a client of Waverly Advisors. Waverly Advisors is an SEC-registered investment advisor. Registration does not imply a certain level of skill or training. A copy of Waverly's current written disclosure brochure and form CRS discussing our advisory fees and services is available at waverlyadvisors.com. They have a 401k complete team that specializes in delivering personalized retirement plan tailored to the unique needs of medical practices and physician-owned businesses. A significant portion of the Waverly Advisor client portfolio is made up of medical professionals and healthcare organizations. So, as a result of that, they've got a pretty good understanding of the complexities required. So they've got extensive experience in corporate retirement planning. They're equipped to address the financial, regulatory, and operational challenges faced by physicians and practice managers. Waverly Advisors provides fiduciary-level support and proactive guidance to help medical professionals manage their plan with confidence. Now, whether you're a solo practitioner or managing a multi-physician group, Waverly Advisors offers a boutique service experience that includes streamlined plan administration, customized plan design and investment strategies, enhanced employee engagement and education, regulatory compliance and fiduciary oversight, along with tax-efficient retirement saving strategies for owners and partners. Waverly Advisors understands that in the medical field, time is limited, standards are high, and trust is earned. That's why they deliver retirement plan services with the same level of precision and professionalism that you bring to your patients. So our guest today is Dr. John Stafford. He's with ENT Associates. He's a Birmingham native. Where'd you go to high school? What part of town did you grow up in?
I grew up in Vestavia.
Okay. So you went to Vestavia?
I did.
Middle school and high school?
Yep.
Okay. And I know you got your medical degree at Columbia University of College of Physicians and Surgeons, and did a residency in otolaryngology with head and neck surgery.
Yeah.
So, and now you've been for the last 4 years with ENT Associates of Alabama.
That's correct. Yeah. Joined that practice right after residency, and I've been here since.
Okay. That's a big, as we were talking about earlier, it's become a pretty big practice. Anyway, today we're going to talk about two non-surgical therapies, radiofrequency ablation therapies to help with both nasal problems and chronic runny nose. So I know the nasal is called Vivair.
That's correct.
And and Ryanair for the chronic. But would you first off tell us, kind of what those are and how they work?
Sure. So each of these is trying to address the underlying problem of either not being able to breathe through the nose very well, or having issues with chronic runny nose and chronic nasal congestion that's not necessarily due to allergies or some other cause. So radiofrequency ablation is a technology that you can think of as a careful, controlled use of heat that allows us to kind of remodel certain tissues in the body. It's used in different parts of the body for different indications, but here in the nose, what we're using it for is ViVair is trying to remodel some of the nasal airway and trying to keep the airway more open so that you're able to breathe better through that. And that's a procedure that can be done in the office with very minimal downtime at all. And then the Ryanair uses the same technology, but for a different indication, which is to treat a chronic runny nose. And that's done by using the radiofrequency ablation on an overactive nerve in the nose that causes that overactive drainage from the nose.
What does it do to the nerve? Does it just calm it, or what happens?
So you can think of it as kind of a calming, or actually, I mean, you're intentionally causing damage to that nerve in order to, I explain it to patients as kind of pressing reset on that nerve.
Okay.
You know,
Okay.
previous technologies have used other techniques of, either cutting the nerve or have used cryotherapy or, freezing the nerve. But the radiofrequency ablation has shown to have really good effect on this problem.
And I know it's in office. How long does the procedure take?
I tell people with most in-office procedures, estimate about 30, 40 minutes, but most of that is going to be the numbing process.
Okay.
So I tell people you'd come into the office on the day of the procedure, and the first thing is I would spray a numbing spray in the nose. And most people who've been to an ENT may be familiar with that process. But that sits in your nose for a few minutes and starts to make the nose feel a little bit more numb. And then after that, I will put some little cotton pledgets in your nose that have a numbing gel on them. And that gel will sit usually for 15 to 20 minutes. You'll relax, close your eyes, we can listen to music, anything that makes you comfortable, and we'll hang out there. And once you are fully numb, I take the pledgets out, and we, depending on which procedure it is, we will do some injection of some numbing medication. After the gel has been in your nose, you should not feel the injection, and that takes another 5 minutes or so. And the actual procedure itself is only about 5 minutes or so, 10 minutes maybe. It's not a very lengthy procedure. So it's all about really making sure that you're adequately comfortable. And then once you are, we move forward pretty easily from there.
So we know the time, and obviously, as you said, the times have obviously mostly numbing. The procedure itself is pretty quick.
Yeah.
How does someone know if they're a good candidate for it?
So in general, I would say, thinking about the ViVair, if you're having a hard time breathing through your nose, you don't feel like you're able to get enough air movement through your nose, I think that's a good reason to see an ear, nose, and throat doctor. Having that first evaluation is important because there's many reasons why your nose might be blocked. And that could include things like a deviated septum, or that could include things related to allergies or other things. However, some patients that have a fairly straight septum, the middle wall of their nose is pretty clear and straight. If they have other issues where the nose wants to collapse when they breathe in, that's the type of indication that we're looking for the ViVair. We're trying to fix that collapse, the area where your nose will want to pinch in on the sides.
Okay.
And oftentimes people will come in and tell me, I can breathe better when I pull up on my cheek. And that is a very strong indicator that the ViVair might help, because what they're doing is holding that cartilage of the nose outward. And that's trying to mimic what the ViVair is going to try to achieve.
So the cartilage is kind of collapsing, or is it?
It is.
Okay.
I use this all the time. I know we're on video, but I tell people, to my patients, say, my nose does it. I haven't had it done yet, but I may, which is when I breathe in, my nose wants to pinch. And that's just due to the airflow, being restricted there. And as that starts to cause you more troubles, you can get that fixed.
Okay. And once somebody's had it, how long is the recovery?
In general, you go home that same day. Usually, if you don't need any kind of relaxing medications, which I will offer to some patients, but most patients, if they can tolerate any kind of dental procedure, they can do this procedure without any kind of medications needed, so you can drive yourself home afterwards, and then or go back to work even that day.
Okay.
The first few weeks you will have some swelling and crusting on the inside of the nose. No significant downtime from this. You should be able to go about your day-to-day life and day-to-day work. But then about the 3-week mark is when people start to really notice the significant improvements that are happening there.
Okay. So how are these two procedures different from if someone has surgery for sinus or nasal problems?
So sinus surgery, nasal surgery, they generally require going under general anesthesia, which means going to the operating room, going fully off to sleep. And with that, there's more downtime afterwards. Typically, when I'm taking someone to the operating room, we're doing traditional surgical technique, which is things like septoplasty or fixing a deviated septum, or fixing the internal collapse that we've been talking about. The other classic surgical way to fix that is with a rhinoplasty, where you actually do a nose job for a functional reason. You try to get the nose to function better by repairing this collapse. That, however, it's very effective, but it takes a lot of time and downtime. And some patients are not great candidates for the Vivera and need to have that done. But that carries with it a longer recovery period, of weeks of swelling and more discomfort, and definitely time off work. So the improvement on that is with the in-office options. You really have no significant lost time. You can, go home that same day or go back to work that afternoon, and the next day you should be doing fairly well, back to pretty much normal activity.
With the collapsing cartilage, what would be the difference between a person who can do the Vivera and a person who needs surgery?
Yeah. Usually it's a history of significant nasal trauma. So if you've had a significant nasal trauma and it's caused other structures in your nose to be damaged, so namely the septum, as we've mentioned before, which is that middle wall on the inside of the nose. If that is significantly damaged and also contributing to the problem, and I don't think that I'm really going to be able to adequately address that with the Vivera, then I think those patients are better surgical candidates.
And let me ask you this regarding the Vivera and the Ryanair: are the results permanent?
So as far as we know so far, yes, we are seeing very lasting benefits. So the Vivera has been showing benefits at 3 years. We're showing that 90% of people are still experiencing the significant relief that they had from the procedure. And at 3 years, the same is true for the Ryanair.
So you mentioned 3 years. So these are obviously relatively new. Have they basically been in use for 3 or 4 years?
They've been around for a little bit longer than that. I know that when I was in my residency, it was probably towards 2020 or so, is the first time I ever saw the Ryanair and Vivera being used. And I think they've been classified, as with all new medical technology, they were classified as experimental in terms of their reimbursements with insurance companies and things. So they lived more in the academic centers. Now that they have kind of been more widely adopted, then they're becoming more widely used throughout the community. So we're seeing that a lot more.
And with your experience, what have you found? What do patients say about it?
Yeah, most people, say they're so thankful that, for the Ryanair in particular, they're no longer carrying around a bunch of tissues and blowing their nose all the time. They're getting significant less dripping. They just feel less congested as a result of that. And the Vivera, people will often say, I can finally breathe.
Okay. Is there anyone who should not get these?
I think, as we said, if there's some people who are better candidates for surgery, rather than doing the in-office procedure, there's also patients for whom we can manage your symptoms with medications. And most of the time, I will start with medical therapy because I think that's the right first step. That includes nasal sprays and trying to decrease the overall swelling that we see in the nose. For the chronic runny nose, we need to rule out that there's any allergy component. So we'll oftentimes do things like allergy treatments and testing. The other thing is to see how it responds to nasal spray. There's a specific nasal spray used for the type of runny nose we use Ryanair for, and that nasal spray will oftentimes control people's symptoms very well. And if it does so, then that's great. I think that's all you need to do. I'm always trying to do the least that I can in order to get you the best result. And for those patients, however, that are not able to get their symptoms well controlled with the medications, those are the patients that I will go and offer procedures for. But, the people who shouldn't necessarily get the procedure are the ones that don't necessarily need it.
With nasal spray, is there a problem, though, if somebody uses it every day over a long period of time? Is that?
Yeah, this is a very common question that we have. So when we talk about nasal sprays, most people think about nasal sprays you get addicted to. And namely, what we're thinking about there is decongestant sprays, such as Afrin or Sinex or other decongestant sprays like that. Those do cause what's called rebound congestion, where you actually become dependent on that nasal spray in order to be able to breathe through the nose. Prescription nasal sprays that we will use, which are steroid nasal sprays and antihistamine nasal sprays, and then the one for Ryanair is another nasal spray. Those do not have the same problem of rebound congestion. They have demonstrated safety and long-term use, and they actually do better the more consistent you are with the use of them.
Okay, surprised. I didn't know about that. Well, thank you. Is there anything else overall we should know about these?
Yeah, I think that we're always trying to work towards finding ways to treat people with less downtime, less time off of their day-to-day work. And so I think that if patients are struggling with these things, but they've been afraid to move forward with further evaluation because they've heard bad things about nose surgeries and all the downtime and all the packing and everything, this is good news to find out that there's options that we have that we can do in the office with minimal downtime, none of the packing. And I think these are great treatment options for many patients.
Okay. Well, thanks a lot for coming in today.
Yeah,
I know
absolutely.
You're leaving here to go right back to seeing patients.
Got to go see more patients.
We appreciate it.
Yeah.
Right.
Thanks for having me.
Absolutely. All right.
Thank you for listening to today's episode of the Ask the Doctor podcast, brought to you by the Birmingham Medical News and Kassouf & Company. Please make sure to like and subscribe, and make sure to tune in for our next installment. I'm Steve Spencer, and wish you and your loved ones a healthy journey until we see each other again.